When a cluster kicks off, these guys kick into gear.
My name's Rebecca Hundy. I'm an epidemiologist here at ACT Health. Contact tracing is a process where we follow up everyone who's come into contact with a confirmed case of COVID.
Contact tracing is really one of the key elements of outbreak control. It's the process that identifies the source of new cases as well as people who might be close contacts with that case who might then potentially be the next round of new cases.
If someone's unlucky enough to test positive, they can expect a call from a contact tracing team.
We basically want to know everything they've done in the last 14 days, and we need to go into that in really intricate detail. Like, we need to know exactly where they went, what day it was, what time it was, how long they were there for, and who else was there. There was about 10 or 11 on average contacts per case. With the cases here we've had in the ACT, so then we have to go on to contact all of them by phone.
It is a bit like being a detective.
Yep, these guys are highly skilled disease detectives.
We've got a whiteboard with lots of lines drawn between clusters of cases.
In the last week, we've contacted over 10,000 people.
Contact tracing teams existed well before the new coronavirus. They helped stop the spread of other diseases like tuberculosis or HIV, but now, deep in a fast-moving pandemic, their expanded teams are our main weapon in identifying and suppressing the reach of COVID-19.
We do have doctors, we have nurses, epidemiologists. We also have students, but most of them all have a health background. Our unit is pretty representative of what most other states have in place.
So I've worked on a few outbreaks as part of the contact tracing team, and I know how hard it is to manage each individual case because they're all so different. They're all about people.
When a cluster breaks out, these guys are the last line of defence stopping it from spreading.
Hi, my name is Pietra. I'm calling from ACT Health. I understand that you recently went and had a test for COVID-19. Unfortunately, I need to tell you that you've actually tested positive for the test.
Yes, we are the ones that are usually the first to tell the case that they've tested positive. We get a range of reactions. Some people can be a little bit upset, a little bit angry to start with, but we just reassure them and they're usually fine. We try to develop a bit of a rapport with them. We use some tips and tricks. We get them to pull out mobile phones, look at text messages, look at emails, calendars, anything that might jog their memory as to what they've done. We always get them to go away, have a think about it and come back to us. I always make sure we ring them 24 hours later as well, because no doubt they'll have remembered something overnight.
In recent weeks, a cluster of COVID-positive people was identified as originating from the Crossroads Hotel in suburban Sydney. It could have escaped detection entirely if it weren't for people like Jenny Musto.
Jenny Musto. Jenny is amazing.
Through painstaking questioning, Jenny's team identified the Crossroads Hotel as the infection site.
What happened was one person from Liverpool was interviewed very thoroughly. At the same time, the person from the Nepean area was interviewed very thoroughly, and he had reported he'd been to the Crossroad Hotel. So we went back and asked the other woman in Liverpool, and they had, and that was it. The link was made. It's not that difficult. It just takes a lot of time.
They've now identified a total of 53 cases, contacting more than 5,000 people. It's work that's taken hundreds of hours.
I think the Jenny Musto team story is a really good example of how contact tracing can work at its best, and that's been obviously very critical.
Rebecca and her team are currently working on the outbreak at the Bateman's Bay Soldiers Club.
We've contacted quite a few people that have been at the Soldiers Club on those dates. A lot of them have actually called in. We might see a few more cases linked to that, but by putting quarantine measures in place at every step, we should be able to contain it fairly quickly.
In early July, when Melbourne case numbers started to spike, the contact tracing team was overwhelmed.
It is simply impossible with case rates at this level to have enough contact tracing staff.
Since then, extra troops have proved critical.
Our contact tracing team is huge, over 2,000.
It's a big team that's got bigger in recent weeks. They are making thousands and thousands of calls, text messages, emails, every effort that can be made.
Make no mistake, these people and their techniques are keeping Australian COVID numbers down, and they're proving way more effective than the COVID-safe tracing app. So far, the app hasn't found a single case not already discovered by a human tracer.
The COVID Safe app is something that can be used to supplement what we do. I don't think you'll ever beat a decent interview with a case to collect that kind of information. It's that human interaction.
The main part of contact tracing is really working with the case to identify contacts, and you can't replace humans in that process.
The task of Australian contact tracers is huge. Their efforts are heroic. We're all a lot safer because of them.
Sometimes I don't really think about it. We just get on and do it. And people go, you realise what you're doing is so important, and I sort of have to step back and go, oh yeah, it is.
Stunning work by them.
Yeah.
And haven't they outperformed that app?
Yes, totally.
Oh, incredible effort.